ObamaCare. Our next guest says the problem-plagued healthcare.gov website is really a secondary issue. The real issue is what is based on policy lies, and those lies, he says, just keep coming. Joining us now, David Stockman, the former director of the Office of Management and Budget under President Ronald Reagan. Also the author of The Great Deformation, The Corruption of Capitalism in America. David, good to have you with us. I think that's a very wise choice of words and the perfect way to put it. These are policy lies, and they compound themselves. And we watch the spectacle today of a sitting president denying to all of his countrymen whom he serves that he didn't say something that is a matter of record on every broadcast seemingly in the country.
Well, I think it's just evidence with each passing day that Obamacare is the greatest legislative calamity in the last half century. And it's not because a website doesn't work or that it hasn't been tweaked. It's the policy design is fundamentally flawed. We have a healthcare system that's already out of control and bloated and inefficient. And what Obamacare tries to do is simply pump it up further with more coverage, with more controls, and with more cost. And we should be going in the opposite direction. We should be going to more choice, get the consumer involved in his own health care, more competition,
maybe the doctors,
more competition among the providers, more economy, and frankly, less insurance.
Everything you're saying is anathema to statist liberals who prefer a government policy and program to anything to do with free markets. And let's be candid. Free markets as such and so described, that is healthcare in this country, has not worked nearly so well as it should have, at least without question, in terms of limiting cost increases. Those prices are not exorbitant because we'll all pay whatever the market will bear for medical services. But I mean,
But we really don't have a market. It is totally distorted by government programs.
I'm just telling you what Republicans have been saying for 20 years.
I know, but here our problem is 170 million people are in employer plans. Those are just big pools of average cost that are tax subsidized. We have Medicare on top of that, Medicaid on top of that, and now Obamacare coming in to round it out. It's a giant bureaucratic, uneconomic, non-market system. And maybe, we keep giving the philosophy of why markets are better and statism is bad, but maybe with each day's surprise and shock, the American people will finally begin to understand that you can't run a 2.7 trillion sector of the economy from the Beltway through a command and control and edict-based system.
Well, there are those who would suggest that he doesn't want to stop Mr. Obama at 2.7 trillion. He'd like to take it to about 16.5, maybe $17 trillion within his control. This is, we have all reported and have looked at all of the evidence of what a mess this is. The mess is compounded by the fact that young people are not signing up for the program. This was fundamentally a redistribution program, and without young people bearing the cost and picking up the immense expenses of the older Americans for medical care, this program isn't going to work. And it's going to cost a lot more than $1.8 trillion if it doesn't.
Exactly, because when you get to the heart of it, when you try to overlay this on the already failed system that we have, you end up with what I call draft, dump, and delete. We're drafting the young people of America to pay even higher premiums to subsidize older and less healthy people when they're already paying huge payroll taxes to fund Medicare and Social Security. That's the first thing. Then we're going to delete. That's why policies are being canceled. They don't meet the bureaucratic standards. That's why employer plans are going to be canceled and people will be dumped, because those don't meet the plan.
The costs are
and
rising.
That's why we're going to basically have cancellations all over the place. You may not have your plan canceled if you work for IBM, but you may have your network canceled. In other words, you won't be able to choose your doctor or your hospital or your specialty provider because it's creating a huge bureaucratic snarl that's beyond imagination.
And, well, unfortunately, imagination no longer so required as it was before the advent of ObamaCare, because we're starting to see the empirical evidence and the pain of this experience. And to watch Medicaid blossom here, I mean, it is ballooning as no one anticipated. So there's going to be a greater enrollment burden on our tax dollars, not a lesser. And I noticed that even though people talk about the business mandate being delayed for a year, and as they discuss the individual mandate also being delayed, no one talks about the recovery of all those taxes we've paid this year and would pay next year, despite the deferral and the delay of services under Obamacare. Imagine that. I'm sure that's just an oversight.
No, it's not. But the cost of this is going to be staggering. Medicaid right now is $300 billion federally. It's going to $500 billion by CBO's lights. I think much more. Obamacare exchanges were supposed to cost $100 billion with 19 million people getting tax subsidies. It could be double that with no problem at all. So we're going to be, I would say, 6 to 10 months from now in a massive fiscal crisis where they will then try to control the cost by even greater regulation.
I guarantee you, when I say I guarantee you that there is in the air just a sense of an American awakening here. People are actually using the words lie when a president says something that is not true and repeats it 29 times. This is, I think, a reason, if you will, for hope and perhaps even change.
Maybe, because David, this could be setting up 214 for a huge referendum, not only on Obamacare,
David, I gotta go.
But on big government.
Thank you, sir. Great to have you with us.
Thank you.
Appreciate it. David Stockman.